and you plan for it, it is serious. If you have a family history where people have committed suicide, then it is serious. If the means that are chosen are very lethal, like you plan it out properly and say that when I'm alone, I want to commit suicide, I want to stay in a room, nobody should be there at that time, and then I want to attempt, it is serious. As opposed to somebody holding a chunni around their neck and standing in public and putting it around the neck and saying, look, I want to die, I want to die. That is not serious. That's a cry for help. That's also a problem, but it's a cry for help.
And when do you know that you are dealing with somebody with a problem? Because half the time, most people think they don't have a problem. Even in our society, because we look at mental illness as such a taboo, we don't look at it as we have a problem. Ninna maatladutunna, vaadi cough ekkuva, vaadiki, you know, you push it under the mat. They make these kind of behavior normal, which is not normal.
Correct.
You don't get upset and beat up people. You don't get drunk all the time every night and blame the world for it. You don't hide and lie and create other stories behind you. You're an honest person, right? Neeku enni kashtalu unna nu abaddalu aadalevu. Oka daggara abaddam cheppi, inkoka daggara nijam cheppi, ide aapadam. Like, you know, last year was the first time I realized that there are so many different kinds of people with borderline personality disorders that live with us. And like normal people, but they're not normal. How do you deal with that, doctor?
So how do you know so for all your audience, because you got out a very good question. See, manam normal ga kuda naaku chala depressed ga undira antam. Let's take an example of a guy who just went through a breakup. These are very common patients that we get, okay?
Yeah.
So this guy just broke up and is very sad and wants to act the devdas and wants to, you know, consume alcohol with his friends and cry and say, chudra, she left me and therefore I'm very depressed and I want to die and all that. But the same guy will laugh when there's a joke. He will still want to hang out with friends, and it's normal in other aspects of life. This is not depression at all. It is a reaction to grief. It is a reaction to the situation. The same guy, suppose he has a tendency for mental illness and he has a tendency for depression. And this breakup acts as the literal catalyst to start off the reaction. Okay, so the depression, and there he will not feel happy even if friends are, are with him. He will not like to hang out. He will not get to sleep. He will not eat. He will lose lots of weight. He may get completely addicted to alcohol, and he may make a serious suicidal attempt. So you see the line between what we call as depression in layman terms and the clinical depression is very thin, and that is why people do not understand when the need for medical help starts. So one pointer where you could actually understand is when your functionality starts to get disturbed. What is functionality? You're a student, you should be studying. You're a housewife, you should be working. You are a professional, you should be able to work. You're an anchor, you're doing a wonderful job, you should be able to do it. But when this gets affected because of your mental state, you know that the illness has started and it is no longer a reaction to the situation.
Wow. Thank you so much. I know you're working in the front lines of COVID and dealing with mental health illnesses also. Did you see a rise in abuse? Because first 40 days, no alcohol annaru. Ippudu over ga taagesi kodutunnara. Intaku mundu mandu ledani kodutunnara. What are the cluster of people that you see an increase at Roshni right now that you're dealing with? Because in Roshni, you deal with a plethora of things, right? You deal with depression, you deal with children with behavioral issues, you deal with married couples and counseling, you deal with a lot of women who want to kill themselves, suicide phone calls you have for women who feel trapped in their marriages and cannot get out. So did I cover all the aspects of it? And, So what did you see the most increase in, Dr. Garu?
What we actually saw, in this lockdown, we also ran a helpline and we're still running it. So it could be found on our website where we are reaching out for anybody who needs mental health. And you imagine we're getting calls right from Meghalaya, Assam to Kerala and Gujarat. Okay. And
Roshni Lanti oka facility India lo ekkada ledu where it's counseling with a doctor like you attached to psychiatry. Usually there are only therapists, psychologists who run that. But you have psychologists and are with a psychiatrist to guide them if they're psychological issues are serious and turns into mental illness.
Yes, yes. We pride ourselves in being very exclusive, especially in Telangana, because this was started with the concept that we don't want people running around for different kinds of mental health help. So when you walk into our doors, you get all help there. So if you walk in with a child who has, say, behavioral problems or academic problems, he need not go to some other counselor for parenting, somewhere in say, Jubilee Hills. He need not go to Secunderabad to get his testing done, and then finally come back to somewhere near Maratpalli for his occupational therapy or speech therapy. So when you walk in, you come with the intention that you're going to be helped completely. Whether you're about to get married and want a premarital counseling, we are already married and having issues, which is quite common in every household.
Wait. Premarital counseling you do.
Yes.
Oh
yes,
my God, I hope everybody watching this goes to a premarital counseling before they get married. Half the time, నాకు అనిపిస్తుంది డాక్టర్ గారు ఇండియాలో పెళ్లి చేసుకోవాలి కాబట్టి చేసేసుకుంటారు సగం మంది.
అంతేనండి, ఎగ్జాక్ట్లీ.
అవునా?
అంతేనండి. Parental pressure, peer pressure, societal pressure is so tremendous, even when you're not prepared. And supposing you're reaching 30 and not married and you're a female, God save you.
Yeah. God only should save us, really. Wow.
Yeah.
So what is the increase you've seen? Is there, going back to that?
Yeah. So increase is mostly in anxiety disorders. See, people who are already anxious, whether they've been diagnosed in the past or not yet been diagnosed, now suddenly they are cooped up in a place where they have no escape. So even if you have issues at home, or if you feel, or you suffer from claustrophobia or fear of closed spaces, that is, you're unable to get out, right? That tremendously increases your pressure. On top of that, any media you open, you have news that the COVID, so many deaths, so many people getting affected. Healthy people seem to disappear overnight.
Yeah.
So that adds to the stress. It adds to all of us, you, me, everybody, right? But
For
to
me
people who
also,
already
yeah.
have...
Yes, true.
So you have me if you want to.
Thank you.
So when you do have people with... sorry, excuse me for that, yeah. So when you have people who are having problems with the mental illness, this kind of anxiety disorders they already suffer from, this becomes much worse.
Sir, నాకేమీ లేదు అయినా ఉంది డాక్టర్ గారు ఇప్పుడు. This Friday will be my last live that I'm doing. I am literally thinking, what am I going to do? Should I continue this? I mean, not that I'm making any money out of this or there is a push for me, just for my... So, andru cheptunnaru kada, stay safe, stay indoors, ani. I'm like, stay safe, stay sane. Like, that's the main thing. If you're sane, you'll come out of this and figure out life any which way. We're so adaptable, right?
But you've done a very good thing. You realize what you've done. You have taken all your energies and you have channelized into helping other people, right? You have used your status in the society to reach out, especially if this is a very much needed thing. So this is a request to everybody listening to you that this is the way you live. You are an example of how it should be done. You know, you de-stress by helping others. When you know you've made a difference in other people's lives, right?
Absolutely.
So,
yeah.
And which is why you're not so stressed till now.
Doctor, I'm thinking about Friday and getting stressed, doctor.
I'm sure you'll come up with something again.
No, but truly, so the first 3 weeks, I was like, why should I shower? I was only showering. కంపు కొడుతుంటే వెళ్ళి స్నానం చేశాను కానీ ఎందుకు నీళ్లు వేస్ట్ ఇంతకు ముందు నేను షవర్ తో స్నానం చేస్తాను. So I was like, no, I'm going to have only one bucket shower because I don't know what the future is. I'm going to save as much as I can. నేను వెండి ప్లేట్లలో తింటాను. ఐమ్ లైక్, నాకు పెళ్ళైనప్పుడు మా మమ్మీ వెండి ప్లేట్లు పెట్టారు అన్నమాట. వెండి తెచ్చి పెడతారు కదా, అది కబోర్డ్ లో ఉండి ఐ pulled it out couple of years ago saying ఏదో డిన్నర్ కి పెట్టడం ఏంటి, మా అమ్మ పెట్టింది రోజు తినాలి. But it takes a lot of water to wash it, so అవి లోపల పెట్టేశాను. But you know what I mean? You're right. For me, I think you hit that nail on the coffin right away. I think my whole purpose, every time something bad happened in my life, I channeled to doing something good. Because it comes to me naturally. I don't have to try so hard. Idigo ee roju elli vallaki nenu save chestanu chudu ani. I've helped so many organizations sitting at home. I realized నేను ఎక్కడికి వెళ్ళాల్సిన అవసరం లేదు, ఇంట్లో కూర్చుంటే చాలా అన్ని జరిగిపోతాయని. knowing more
Exactly.
about yourself in front of you. I feel this COVID has put ourselves in front of us. Intak mundu
Absolutely. Absolutely.
కోపం వస్తే పద స్టార్బక్స్ కి వెళ్దాం, ఎవరికో ఫోన్ చేద్దాం, ఒక ఫ్రెండ్ దగ్గరికి వెళ్దాం, ఫ్రెండ్ ని ఇంటికి పిలిపించుకుందాం. We had a lot of allegations to not put attention to what is going on in our brain. నిన్న మీరు ఒకటి అందంగా చెప్తున్నారు డాక్టర్ గారు, it got disconnected, saying మనస్సు మానసికం అనేది ఏంటి అని. So and when it puts yourself in front of you, why are we so afraid? మనల్ని మనం చూడడానికి అంత భయం ఎందుకు పడతాం మనం? We should be happy to see ourselves, no?
Not many people are. We have so much of pain and grief and negative things, suppressed inside that we often
pain
forget.
లేకుండా ఎవరైనా ఉన్నారా?
ఎవరు ఉండరండి.
Thank you for that.
But what we forget is that there's a lot of positivity inside us also. It needs like there's a saying circulating around which says that if you can't go outside, go inwards. Look inside you, and there's so much beauty there, and you could do so much for yourself. Find yourself again. Like somebody was asking yesterday, how do we de-stress? I believe that this is the only time you have in your life where you are on a prolonged holiday, right?
Yes.
So this excuse of I don't have time for my children, I don't have time for my hobbies, I don't have time to exercise should be all put in the dustbin. Get out and dance and do what you want to do.
Yes.
So this is a time like no other. You're responsibly staying at home. Nobody's asked you to. The government has asked you to. So you're not playing hooky from work. You're actually there because somebody's asked you to do that.
We are safe at home because people like you are going out and taking care of us. The least we can do is fight this war by sitting at home. It is a war we are at.
Absolutely. Absolutely.
And people are not realizing that we are at war just because we are sitting at home,
True.
Yeah. How does ఇప్పుడు నేను నా కొన్ని వేల మంది చూస్తున్నారు ఈ లైవ్ డాక్టర్ గారు. ఇది చూస్తున్నప్పుడు there's something that I need to come to you అనుకున్న వాళ్ళకి what are the triggers that they should look if somebody is looking at this live, what should they be asking themselves if they have some issue that needs to be addressed?
Okay, so let me put it this way. Like let me draw a comparison between physical illness and mental illness, right?
Okay.
So మనకి కాళ్ళు విరిగింది అనుకోండి, మనం ఫిజియోథెరపీ ఫస్ట్ సర్జరీ చేయించుకుంటాం కదా. మైల్డ్ ఫ్రాక్చర్ అయితే ప్లాస్టర్ చేసుకుంటాం, ఫిజియోథెరపీ చేసుకుంటాం. పెద్ద ఫ్రాక్చర్ అయితే మాత్రం ఫస్ట్ సర్జరీ చేసి ఫిజియోథెరపీ చేయించుకుంటాం.
అవును డాక్టర్ గారు.
Counseling, therapy and medication is the same, right? So if you are having a mild illness, counseling helps. That counseling can start right from your family members, friends. ఇది పని చేయదనుకోండి, the next step are the professional counselors and therapists, right? అది కూడా మనకి పని చేయటం లేదంటే you understand that the biology inside is haywire and it needs to be fixed again to bring you back to your normal self. అక్కడ మెడిసిన్స్ పనిచేస్తాయి, దాని మీద కౌన్సిలింగ్ బ్రహ్మాండంగా పనిచేస్తుంది.
సో బయాలజీ అంటే ఇప్పుడు లేమన్ లాంగ్వేజ్ లోనే మాట్లాడతారు. సో మన బ్రెయిన్ లో చాలా వైర్స్ ఉండి న్యూరాన్స్ ఉండి అవి ఫైర్ అవుతూ ఉంటాయి కదా. ఇప్పుడు నార్మల్ గా ఉన్న వాళ్ళకి సరిగ్గా ఫైర్ అవుతా ఉంటుంది. లోపల వైరింగ్ కొంచెం డిఫరెంట్ గా ఉన్న వాళ్ళకి మందులేసి ఆ వైరింగ్ సరి చేయొచ్చు అంటున్నారు.
ఎగ్జాక్ట్లీ.
Okay. ఊరికే మెంటలోడ they just not, that's not the terminology.
At all. Okay. By that we're doing great harm to the society. అలా అని మనకి అన్ని జబ్బులు we are putting it, we don't even address minor issues.
What are minor issues, డాక్టర్ గారు?
చూడండి, ఇప్పుడు జస్ట్ డిప్రెషన్ స్టార్ట్ అయింది అనుకోండి. Okay, you're afraid to go to Dr.Srilaxmi because you feel what will people say if I go to her. Okay. The other thing is ఈ వీళ్ళు సైకాట్రిస్ట్ పిచ్చి వాళ్ళు మనకేం చూస్తారని. I hope with this thing is dispelled that we are as normal as everybody else.
Yes. I was reading something Freud said yesterday somewhere. I wanted to quote it, I forget. Yeah, go ahead. Yeah.
So what happens is, what starts as something as mild depression, which could be easily treated, counseling anukondi, therapy anukondi, inkoncham aithe medicines anukondi, and it would have finished off in about 6 months, say. Now when you neglect that, it becomes more and more chronic. And there comes a time when it's totally dysfunctional. You can't get out of home. I have patients who are sitting at home for years because they've not addressed it in the right time. They can't work at all. And these are highly qualified people. I'm not talking of people who are, 6 or 7 pass. These are MBAs, these are MBBS, these are MDs who are not able to go to work because they've not addressed their mental health issues. And why did they not address? Because they are so afraid of the stigma which is associated with it. And how
They'd
sad is
rather
that?
suffer and die and be in that same place than move and shift the energy and get help. That is so sad,
Exactly.
Dr. Garu. నాకు అది అర్థమే కాదు అసలు. నువ్వు ఈ డిప్రెషన్ లో ఉన్న ఒక లైఫ్ ని వేస్ట్ చేసుకుంటావా? నీకు హెల్ప్ ఉంది, నీలో ఏదో సంథింగ్ ఇస్ ఆఫ్ అనుకున్నప్పుడు go get help, you know. And most
Exactly.
people don't realize, Dr. Garu, oh, I'm depressed, I don't want to go out, I am like this, honey. But you being like this affects all your family members. They don't
Absolutely,
realize the
absolutely.
effect that it has on them, where they are not able to fully live their life because they are afraid of you and dependent on you, or they're worried about you.
ఆల్సో దే వరీడ్ అబౌట్ ద సొసైటీ. ఇప్పుడు సైకాట్రిస్ట్ తీసుకెళ్తే మా అమ్మాయికి పెళ్ళెలా అవుతుంది, జాబ్ కంపెనీకి తెలిస్తే ఉద్యోగాలు పోతాయేమో, యూనో ఫ్యూచర్ మనకి ఫ్యూచర్ ఎలాగా, చిల్డ్రన్ కి ఏమైనా ప్రాబ్లమ్స్ వస్తాయేమో, మేబీ దే విల్ బి స్టిగ్మటైజ్. దీస్ ఆర్ ద ఇష్యూస్ ఎవ్రీ హౌస్ హోల్డ్ ఇస్ హ్యావింగ్. They rather go to a temple and pray rather than coming to a doctor and take treatment. Now, I had a very good faith healer, these Maulvis who give taweez, no? One of my patients went to him and said, Maulvi sahab, nahi, humko dawai nahi lena, sirf dua dijiye, I will get better. And this guy had severe schizophrenia. And that Maulvi was so well educated, he told him, beta, dawa bhi hona, dua bhi hona. That's the way it should be.
Yeah. That is so important.
Yes.
Tell us a little bit about how the family gets affected, Andy, when patients are there and they are not willing to take care of, let it be about abuse.
Yes.
I see a lot of abuse that happens. It could be mental, physical, emotional, verbal. If you don't break that cycle, what happens
Assistant
within
tests
you?
new voice
How do
matching
you
feature
get out
to
of the
verify
families that somebody is addicted, has an addictive personality,
This
but you're
restriction.
stuck in it? What are the healthy ways to get the person who's abusive to therapy or the person who's addicted to therapy? How can we convince any of them? మనకు అర్థమైపోతుంది, అదిగో వాళ్ళ దగ్గర ఏదో తప్పు ఉంది, he needs help. Somebody has severe anger bouts and fights with everybody. Like అర్థం కాదు, but they're not like that in a normal circumstance. How do you convince them to come and get help for their own sake?
It's very difficult, Andy, because it's usually the spouse who's getting abused, right? And it's the spouse who has to get the person for treatment. Now, abuse can be so subtle. You sometimes do not even realize that you're getting abused.
Yeah.
Let me give you an example. కొట్టేవాడికి మనకు తెలుస్తుంది, తిట్టేవాడికి మనకు అర్థమవుతుంది. Now, there are some patients of mine who will come and tell me, doctor, my husband says, I'm totally inefficient. I just cannot manage the house. This lady has been married for 10 years and raised 2 children, very good children who are doing well in life, but yet he says you cannot keep the house clean, you're not doing it properly, you're this and that, and all that nitpicks and all small things. This is also abuse because it puts her down so much that she loses confidence. And she gets into a phase called learned helplessness. That means you learn that you're helpless. Over the years, you've learned that I cannot help myself. So no matter how other people or well-wishers tell her that, it is his fault, she'll say, no, it is my fault. That is playing victim. Okay? This needs to be corrected in the beginning itself. We empower them to understand that it is not you, but it is him who is doing that. I'm just using the term gender alternately, but it can be either ways. Yes. So first thing is to empower, to say that, look, you're not at fault, you're the victim here, and it is not right to take the abuse, right? Ultimately, the choice is hers to whether to address the abuse, whether to get out of the situation or not. But our duty is to empower, to make them understand. And once they understand, we give them sources of how they can get out of the situation. Believe me, once they start standing up for themselves, many of these situations are resolved. When the abuser realizes that this is not going to work, I can no longer manipulate.
మీరు ఈజీగా చెప్పేస్తారు డాక్టర్ గారు. జీవితం అంతా ఒకలాగా బ్రతికి స్టాండ్ అప్ ఫర్ యువర్ సెల్ఫ్ అంటే where will I get the strength from?
We are there. We are your source of strength. Okay. This is where we come in. I understand. It's very difficult to, you're set to a pattern of thinking. How do you change that? How do you suddenly believe that he's wrong and I'm right? No, it doesn't happen.
I'll share something personal with you, and I'm going live with it. So Mummy and me were having a fight. She always complains about her husband. I'm complaining about my husband. She said, Lena, Minan Toti. I said, yeah, you had no choice.
True.
And it stopped her like in her tracks. She said, what do you mean? Naku pillalu unnaru, naku idundi, naku adundi, pillu okate. I said, no, Amma, it is not about the man in your life. It is about anything in your life.
Correct.
నీకున్న డిజైనింగ్ ఐడియాస్ ఇంకెవరికి లేవు. If you thought you're good enough to step outside, you would have done so well. But you're so used to the peer pressures. I said, నాకు అవసరం లేదు, నాకు నచ్చదు అంటే నేను అలా బ్రతకాల్సిన అవసరం లేదమ్మా. Anything in my life. And boundaries is another thing that I'm learning. I'm now learning about boundaries, Dr. Garu, that you have to have boundaries. Can you talk about what is having boundaries? I believe you should have boundaries for your parents, for your kids, for your husband. I had no idea boundary ante enti. Our boundaries ela create cheyali మన own family members and friends toti.
కొంచెం కష్టం అండి. In our culture where everybody is, even the neighbor asks you, when are you going to get married or when are you going to have children? Boundaries are very difficult to draw. But boundaries need to be drawn when you feel the distress or you're feeling intruded into your personal space. Now, I have a 15-year-old. He tells me, if I tell him, you cut your hair this way, he's saying you're intruding into my personal space. So I have to step back and respect his boundaries.
Exactly.
Right? However, boundaries have to be also balanced with responsibility. If you are responsible enough to take care of yourself and you can prove that, then you're very much welcome to draw your boundaries. But if you're irresponsible, for example, most of our teenagers are talking throughout the night on WhatsApp, playing games, video games, wake up at 1 o'clock, miss college, studies go down the drain, and then say you cannot intrude into my boundaries, it's my personal space. That's not going to work out. Show your responsibility, be what you are, prove yourself, and then draw boundaries. Everybody is going to respect it because they understand that you're able to look after yourself.
That is another big problem, Dr. Garu. Responsibility తీసుకునే మగాళ్ళు ఎవరు ఇప్పుడు ఇక్కడ ఇండియాలో చూపించండి నాకు మెయిన్ గా. I did this wrong. I am willing to change and show me one guy. He will come and manipulate what he did for his benefit to make it go right and wrong. I mean, book-wise, we can easily talk, Dr. Garu. That's another thing. Think India lo, I don't see responsibility or accountability. They don't have that. దొరికారంటే ఓ నేను దొరికిపోయాను సారీ అనేసి పక్కకి వెళ్ళిపోతారు తప్ప. Responsibility తీసుకోరు. How do you responsibility తీసుకోవడం అంటే ఏంటి? Simple. Just
responsible for your actions and your place in society. If you're a father, you should be responsible as a father. But then you have to understand that not everybody is wired in the same way. This is where premarital counseling or even marital counseling comes into play. Our expectations are also different, you know. Women expect different things, men expect different things. Sometimes it does not match. What for me is responsibility may not be responsibility for you. Like if I want my husband to stand up and, you know, maybe teach the child, do his homework, that much is enough for me. Everything else I will do. Maybe is my definition of responsibility, right? So understanding each other and having a proper wavelength where you're matching and then discuss the responsibilities is very important. It is much easier said than done. I actually, respect all women who are taking all responsibilities at home. And alternately, there are a lot of men who are taking a lot of responsibilities at home where women are not being very responsible. So it goes both ways.
Especially now with nuclear families, because the women are going and working now, there is a complete flip side of it. Bah, mere na nin koda work ke lost nan. You do that work, you know.
Correct.
I feel a healthy separation of work needs to be addressed in a marital in marriages, and Dr. Garu, like when they come in to talk about what is healthy, what can each of us handle, and how can we take care of each other in the most respectful, loving, compassionate way. Ee padalani over the top elta nenu maatladte evartotaina.
Kani, I think the change should come from this generation of parents. Manaki ippudu entaindi, our daughters were educated to work outside, but our boys were not taught to work in the kitchen. So that is causing a lot of tension, right? So for men, they've seen their mothers working in the kitchen. Our husbands have seen their mothers working in the kitchen. They don't really think it's their responsibility to contribute. It's not their fault. They've just been conditioned that way. So I'm a mother now. I have to teach my son that cooking is as important as, say, going out and playing cricket, because that is also your responsibility. If you go about and buy vegetables, you should also learn to cook it. So next time for him, when he is married, he understands that, okay, this is also my job. It's fine. So the onus lies on us to bring out the next generation properly.
Dr. Garu, you use the word conditioning. Adi chaala mandiki ardham kaadu. Conditioning ante enti? Mana human mentality, we are conditioned like this. We are conditioned like this. Can we uncondition ourselves and relearn, unlearn?
Oh, yes.
So conditioning ante enti cheppandi, Dr. Garu.
యా నేను ఒక mental illness తో పెట్టుకొని ఒక సైకలాజికల్ డిజార్డర్ తో పెట్టుకొని నేను కండిషనింగ్ చెప్తాను. ఫర్ ఎగ్జాంపుల్, ఇఫ్ యు ఆర్ లెట్ మీ టేక్ ది ఎగ్జాంపుల్ ఆఫ్ వన్ ఆఫ్ మై పేషెంట్స్. వెన్ హీ వాస్ వెరీ యంగ్, హీ వాస్ ప్లేయింగ్ విలేజ్ లో గుడిలో దగ్గర ఆడుకుంటున్నారు అనమాట. సో వెన్ హిస్ ఫ్రెండ్ సడన్లీ వాక్డ్ అవుట్ అండ్ క్లోజ్డ్ హిమ్ ఇన్సైడ్ ద టెంపుల్, గుడిలో. సో హీ ఒక మాతాజీ ఇది అక్కడ ఉండేది, అండ్ సడన్లీ ఇన్ ద డార్క్నెస్ హీ హ్యాడ్ టు సీ హర్ ఫేస్ అండ్ హీ వాస్ వెరీ టెరిఫైడ్. సో ఫర్ హిమ్ now it was just that momentary fear got conditioned to close spaces. So the fear spread to close spaces now. ఇప్పుడు ఆయన బతికిసేడు అన్న ఒక 50-60 years బతికిసేడు, పర్వాలేదు, క్లోజ్ స్పేస్. He never allowed anybody to lock it from outside. No rooms were allowed to be locked from outside. He would sit in my cabin only if the door was open and he could, had the opportunity to run out. He came to me because he was a tailor by occupation actually, and he worked hard and educated his son, and his son was in the US. And now he had to sit in a flight, which is a closed space, and go to his son. And he could do it.
Wow.
So that is where deconditioning, we deconditioned him so that he flew thrice now already. And I'm so very happy every time he goes and comes back.
I got goosebumps, Dr. Garu.
Yeah.
Wow, that's fantastic. Because even the smallest things debilitate you. మనం ఎంతెంతో చెయ్యాలనుకుంటాం, మన మైండ్ లో ఉన్న ఫియర్స్ మనల్ని ఆపేస్తూ ఉంటాయి, and we don't realize that there is help for this. మనం వెళ్ళి మీలాంటి వాళ్ళతో ఎవరితో అయినా మాట్లాడితే that we can break through that and live life in more color.
Correct, absolutely.
Wow, this is fantastic. I'm so glad we came back, and I really wanted to talk about mental illness, health, family therapy, because మనం అనుకుంటాం నాకు ప్రాబ్లం అంటే నేను ఒక్కదాన్ని వెళ్ళాలి అని, but that effect comes with the family, right? If there is a family member, take everybody. Explain what premarital therapy explain చేశారు. What is family therapy, Dr. Garu?
Family therapy, usually illness is low when one, like you said, sometimes see, like again with an example, if a husband wife come to because they're having, how do we deal with it? I'll tell you. So husband wife come with a lot of conflict, and they understand that they need some kind of counseling, marital counseling. Okay. So the marital counselor takes it up in the beginning and realizes that the wife probably is having some kind of suspicion of the husband, which is aggravating the issues. Or the husband is having some kind of emotional instability because of which he keeps on, gets unnecessarily provoked into a lot of aggression. So just by counseling, this is not going to help. This is when they're sent to me. So we settle the person who's having the issue. They go back to counseling again and relearn to establish the relationships. So this is just one example. Family counseling also is done when, like you rightly said, when there is one person having mental illness and that affects the entire family. Now, take an example of a patient of schizophrenia. Schizophrenia is a severe mental illness. So they are suspicious, they hear voices, they're aggressive, they don't believe that you're doing good for them, they don't go to work, they don't have a bath, and so on and so forth. And it starts young, unfortunately, and goes on for many years. The entire family is devastated. Because this is a child, say a boy or a girl who's just come to marriageable age or just come to working age, and everything is stopped in that family now. Okay? This is the time when entire family needs to heal. They need to understand how to go about dealing with the child. They need to understand that medication may be for a lifetime, but it is controllable. And he can lead a productive life too. And how can this support without getting unnecessarily over-involved, like, ayyo nanna padukunnava, tinnava, కూర్చున్నావా, నించున్నావా అని ఎక్సెస్ వరి కాకుండా, అలాగే నువ్వు నా వేస్ట్ గాడిరా, నువ్వు నా మీద ఒక ప్రెషర్ రా అని వాడి గడిగడికి తిట్టకుండా, how to maintain a balance, treat him normal at the same time, take the right kind of treatment also helps in such cases.
So you give those tools to us, Dr. Garu?
Yes, absolutely.
For the entire family?
Entire family.
Wow. But you should be willing to work towards it.
Absolutely. Like your psychologist yesterday very rightly pointed out, the work for a work in therapy always starts when you reach home. Like you also said, it's very easy said than done. So we only advise, we only give guidelines. We never tell you that you're right or you're wrong. We can say, look, this seems to be a problem here and this seems to be a problem there. Let's both of us meet midway and resolve it like that. Okay?
So therapy koste meeru ippudu nenu ostunanu. Okay, I'll always put myself an example saying, my daughter, she's an angel. I'm just saying. Why my daughter? I'll use my husband. My husband's very lazy. He's always irritating me. He's doing this, he's doing that. You need to talk to him, doc. So
Yeah.
when I come
Yeah.
to you complaining about him, you will first address what it is that's bothering me about him laying on the
Yes.
couch.
Yes. Yes. Absolutely. Absolutely. And then only
I'm
we
not
call it.
coming. If you tell he's wrong, then only I'm coming.
I
I'm
would
just
never say
kidding.
that.
I'm just kidding. I'm just kidding. No, but that's the mentality. No, we want to point fingers and say the mistake
Yeah.
is in them, not about the other three fingers that are showing at
It's
us.
always like that in all of us. In all of us, we hardly ever introspect. So it's always easy to blame the others. It's always easy to say that we look for problems external. We hardly ever look internally to see, am I contributing to the situation too?
Wow, am I contributing to the situation too? Dr. Daru, we are at time. We actually went 10 minutes ahead of time, but I'm going to end with this where I ask, everybody talks about being grateful and having gratitude and being mindful. Kruptanga, what is being mindful? What is having gratitude? అనేది మాట్లాడతారా?
Mindfulness and a therapy undandi. So let's talk about that. Mindfulness is being here and now. Okay. So let's take an example of the lockdown. We are worried that we most of us are that jobs untaya leda, EMIs ustaya leda, EMI ela kattukovali, what about my finances? But we forget that today is only today. We don't even know whether there is a tomorrow, right? So when we live in the present, feeling all sensations around us in the present is being what is called as mindful, and an extension of that is gratitude. So I am grateful that I'm at home, and today I'm especially grateful that the internet connection is doing very well.
Yes,
And
yes.
and I have more time with my child. I have more time with my family. I can relax. I've been so sleep deprived for so many days. I can actually go to sleep. This is a boon. Why do we take it so easily? It's not just about money or working or the future, right? The present is only mine, the one that I can control. And when I live completely with all my senses in the present, I am mindful.
When I'm present with all the senses around me all the time, then I'm being mindful. Awesome.
Yes.
Is there anything else you would like to talk to us, Dr. Garu, or share with us in terms of anything I missed out? Because this is a topic that I'm very close to my heart, but don't know much about. And this is more than an interview. It was more about curiosity for me to find out more into who a psychologist is or what a psychiatrist does, and finding the balance between both. And I think you cleared it out very beautifully. And we're so grateful for a place like Roshni to be there, and for all the incredible work that you do. I wish and I pray that, more people come out to be more freer for themselves.
Yes.
When for themselves, not for anything more than that. So would you like to add anything else to that, Doc?
Yes. The last few words is, your mind is a part of you. It is as important as your physical health. Just as you would rush to a doctor for any kind of pain or fever or jaundice or whatever, depression, sadness, suspicion, unhappiness are symptoms of a mental condition. Come to us. We'll help you sort out whether it is just a normal thing. See, there are many times when I have sent back patients saying that you don't need medication, please. You just go for counseling, you go back. So do not fear that. And come to us. We'll help you to guide to whether you need counseling, whether you need medicine, whether you need both. And very, very importantly, when you see people taking medication, when you hear from neighbors and friends saying that these medicines are addictive, this will cause weight gain, this will cause vegetative state, no, please do not believe all that. You cannot imagine how many people you see around you, functional doctors, engineers, bankers, actors, who are on medication and you will not even know about it. It is absolutely safe. It is as safe as you take a blood pressure medicine or you take a diabetes medicine. So mental health cannot be ignored. A healthy mind only will lead to a healthy body. If you are down mentally, unlikely that your physical body will also be good.
Wow, that is అదే అంటారు కదా, నీ మైండ్ లో ఉన్నదే నీ బాడీలోకి మేనిఫెస్ట్ అవుతుంది. All pains are first triggered from your mind, and now your body is showing you in different ways that something is off on it. Wow.
We psychiatrists feel that we are the doctors, and unless our part of the body is not healthy, anything else cannot be.
I totally believe in you. There was a book called You Can Heal Your Life by Louise L. Hay. That book changed my life. That book really changed my life, to see that there is a possibility. The way you change your mind can affect how you feel about your body was a
True,
revelation to me. I read
true,
that
true.
when I was 16, I think.
Uh-huh.
Yeah. Mm. My questions haven't stopped though. Since but thank you so much, doctor. I'm so glad we were able to do this morning. It's so important. I hope ఈ లైవ్ ద్వారా ఇంకొంచెం మంది ఓపెన్ అయి ఉంటారు మెంటల్ హెల్త్ గురించి మాట్లాడడానికి. వాళ్ళు మానసికంగా ఏ బాధ పడుతున్నా, because right now it's more important. Schools are the most affected, colleges are the most affected. As you hit teenage years, you want to spend more hours outside than inside. So
Correct.
parents ఎవరైనా చూస్తున్నా, పిల్లలు ఎవరైనా చూస్తున్నా, please get help, and so you can live your best health. ఎవరి గురించి ఆలోచించినా, మీ రెంట్ ఎవరు కట్టట్లేదు, మీ డాడీ మమ్మీ తప్ప. మీ వాటర్ బిల్ ఎవరు కట్టట్లేదు, మీ ఎలక్ట్రిసిటీ బిల్ ఎవరు కట్టట్లేదు, మీ ఫుడ్ ఎవరు పెట్టట్లేదు. సో యూ డోంట్ హ్యావ్ టు లిసన్ టు ఎనీబడి అదర్ దెన్ యువర్ సెల్ఫ్. See what is right for you, so you can be better for yourself, better for your neighbors, better for your family, better for the society, and better for the nation, and better for the world in general. So go seek your happiness, because it lies within you. Happiness is nowhere else. Everything I've achieved in my life that I wanted to do, more than, I was an actor in Hollywood, then came to Tollywood. I've been able to help people. People talk to me as if I'm already a politician, which I'm not. I don't even behave like one. I don't act like one. I don't wear clothes like one. But they look up to me as a leader, not because I hold any post, only because I want to get up and live the best life possible today. So everything is ticked out because I'm able to, I want to push boundaries. I want to learn more about myself. Let it be sadness, happiness, ecstasy, whatever it is. There is a method to the madness, and that method is going to a psychologist. So find your truth and live your best life. Thank you, Dr. Garu.
Thank you.
It was really nice having you. Thank you.
And thank you so much for making the double effort again today morning.
I had to, because there were so many amazing things that I was like, oh, we cannot lose this time, But yeah, cool. Thank you,
we're all the more.
Doctor, one more thing.
Yeah.
Can you suggest a book, one book that people can look into and read into to give them more insight about what all this is? A beginner's book.
I'd rather that you came to us. You know what happens? When you're an anxious person and you read the book and you're not able to help yourself, you get all the more anxious.
Oh.
Isn't it? So it says you help yourself this way or that way and do this and do that. There are lots of books in the market. You can pick up any 7 Habits of Highly Effective People and things like that. Yes, they're very, very good books and very good authors. But if you're already struggling with a problem and you're not able to apply it, it pushes you further down.
I hear you.
That should be kept in mind. Yeah.
Cool. You were saying something just as we were.
Yes. I wanted to thank you for batting from a corner. I think mental health has got a new boost because you're with us. And I thank you so much.